Now that you've learned about the psychological disorders, we're going to be looking at the treatment of these disorders now. And what I'd like to start out with is let's look at a list of different psychotherapists here. And notice that there are a lot of names, titles that you don't see on this list that you might be familiar with. Things like life coach or just therapist. We'll talk about that in a moment. These indicate a degree in psychology and regulation by the APA. So if you want a therapist who has a background in psychology, you're going to look for one of the titles on this list. And notice that the first two carry the word psychologist. In order to carry that word in your title, regardless of whether you're a counseling psychologist or a clinical psychologist, or like myself, a social and personality psychologist, you must have a PhD in psychology. So with these first two, you know that they have a PhD in psychology. Now, what's the difference between them? Well, a clinical psychologist is going to work with treating psychological disorders, like the ones that we have recently studied, and many, many more. A counseling psychologist, on the other hand, is going to help people deal with life events. So it could be, for instance, helping someone deal with a divorce or the loss of a loved one. Okay, that would be a counseling psychologist. And again, both of these have PhDs. Now, a psychiatrist is very interesting because a lot of people will say, when they're a student, oh, I want to be a psychiatrist, yet they will, before they're really informed about that, they will think that means doing therapy. And they do therapy, but they don't do the type of therapy you're probably thinking of when you say therapy. We generally, when we say therapy, are talking about a psychologist and a client meeting and talking for a period of time. So in other words, talk therapies, where a psychiatrist does biotherapy. In other words, they're dispensing medications. Okay, so it's not unusual for someone to go to a firm and see a psychologist, for instance, a clinical psychologist, okay, for hour appointments, okay, and then see a psychiatrist every now and then for a 15-minute appointment, okay. All right. Now, a psychiatrist, in order to have that in their title, must have psychology, PhD, but also they are a medical doctor, an MD. Okay. Now, this next one is a really interesting one. Clinical social workers can work in different realms, but one of the most interesting ones is working with what we call deinstitutionalization. So you're familiar with the term institutionalization. This would be when people are being let out of a mental institution after a long period of time in one, and they need to adjust to the world. A very interesting position. You're going to see a really interesting depiction of this in the film that we're going to be watching at the end of the semester with the character whose name is Frank. Okay. With this particular occupation, in order to hold this title, you only need a master's degree in psychology. Now, psychiatric nurses, just like that implies, these would entail a nursing degree, and psychiatric nurses usually work within a psychiatric hospital or institutionalization. All right, and then we have counselors. Now, notice we have counselors, we have counseling psychologists. So, to carry the title of a counselor, you only have to have a master's degree in psychology. Okay, and again, you'll be dealing, just like a counseling psychologist, with helping people with life events like divorce, losing a loved one, losing their job. In this current economy, a lot of people have lost their homes. That's a particularly difficult thing to deal with since our home is our safe place.